Hi, I'm Dr. David Sandler of the Oklahoma Heart Institute. And what we wanted to do today was provide you a primer on atrial fibrillation. As you may have heard, September is Atrial Fibrillation Awareness Month. There's a lot to know about atrial fibrillation. We certainly aren't going to cover everything today. But I just wanted to go through some overviews and some big topics to better understand your condition or your loved one's condition, and to better understand what questions you really want to ask your doctor when you do get in front of them. So first of all, atrial fibrillation is one of the most common heart rhythm disorders in the world. It affects millions and millions of people, and it's one of the biggest causes of stroke. When we talk about treating atrial fibrillation, we're really talking about two separate things, and this is really hard to separate for patients and for physicians sometimes. And I like to think of them as two buckets. The first bucket is doing things to help make you live longer. The second one is a bucket of doing things that make you feel better. And you can obviously think of things that, affect you in life that might fill one of those buckets. You know that chocolate cake is going to make you feel really good, but may not actually make you live longer. And you may not really love that kale salad, but it's going to make you live longer. So when you think about the treatments, just remember that a lot of these do not cross over the way you might think. So specifically for atrial fibrillation, the thing that's going to make you live longer is not having a stroke. So let's talk about that. There's a little part of the heart called the left atrial appendage, which is basically a cul-de-sac in the heart. And when blood is being squeezed at 60 beats a minute or what have you, it moves and it remains liquid. However, when you're in atrial fibrillation, the blood doesn't move and it becomes a clot. So there's basically two ways to think about how to prevent a clot from forming there that would lead to a stroke. The first is something we've been doing for decades, and that's thinning the blood. It started with warfarin, and now we have a whole bunch of other newer drugs. But that's one way to help prevent you from having a stroke. The second thing we can do is put a little plug in that appendage or cut it off during surgery, called the ligation or the Watchman plug. And what that does is that eliminates that cul-de-sac from the blood supply. It makes it so that you can't get a clot behind there that would fly out and would cause a stroke. So those are two effective ways of preventing stroke. There's not a single person out there that says they felt better when they were put on a blood thinner. And there's not anyone who felt better than when they had their Watchman put in, except for the potential of coming off of their blood thinners. On the other hand, there are things that we do to help make people feel better from their atrial fibrillation. There's a whole group of drugs that we use, each with potential side effects, each with their issues, none of them proven to make you live longer, but all there to help you feel better with your atrial fibrillation. Now, they don't work in all people, and they have side effects. So some people end up with something called catheter ablation. Catheter ablation is where we put catheters in the vein of the leg. We cauterize areas of the heart that trigger most people's atrial fibrillation. Together, these are the therapies that we use to help prevent atrial fibrillation symptoms. It is inconclusive if those things make you live longer. In large populations, we have yet to prove that definitively. There's certainly a trend that we do when we're successful. But overall, you shouldn't have an ablation, and you shouldn't go on those sort of drugs to help make you live longer. So, in summary, we have lots of tools in our armamentarium to help treat your atrial fibrillation. Remember, we have drugs and procedures to help you not have a stroke. We have drugs and procedures that we can apply that can help make you feel better with your atrial fibrillation. I have to tell you, AFib is a really common, often humbling disease, and there's so much out there. So please, if you have atrial fibrillation, see a heart rhythm specialist, talk to them, and find out what might be best for you. I think that's a really important question because it turns out that most atrial fibrillation is actually preventable. When you look in general, the age at which atrial fibrillation becomes more common is around 65 years of age. If we live long enough, I think we're all going to have atrial fibrillation, but there are things you can do to help push it off or have it come a little bit earlier. One of them you can't control. Genetics. It turns out atrial fibrillation is very genetic, and if your parents have atrial fibrillation, you can probably suspect that you might at some point in your life. Now, there are other things that you can control. Obesity and sleep apnea are the biggest ones. So if you look at people who are normal weight to overweight and to obese, you can see that if you follow them long enough, they all start having atrial fibrillation when they have obesity, and especially morbid obesity. What goes with obesity is also sleep apnea. So sleep apnea is a condition in which people stop breathing in their sleep. Many people don't know it. They find out that they have it from their spouse, for example. But the causes of atrial fibrillation can be triggered to sleep apnea in many people. The good news is treating your sleep apnea and the obesity can dramatically reduce the chance of you developing atrial fibrillation and can reduce your episodes of atrial fibrillation once you've been diagnosed. This is actually very interesting. There have been large studies looking at normal coffee consumption, and it turns out that it's actually protective. Having a little bit of coffee in the morning and throughout the day seems to actually protect people from atrial fibrillation, not cause it. However, once you start getting into the 5-6 cups of coffee per day, it does increase your chances of atrial fibrillation. It's important to remember that that's in general for large populations. If you have noticed that drinking coffee increases your palpitation, then it's obviously a trigger for you and you should avoid it. Energy drinks are a little bit different. Energy drinks come with all sorts of natural stimulants, each of which has the potential to increase your atrial fibrillation. And unlike coffee, which people usually sip over longer periods of time because they're warm, drinking energy drinks rapidly certainly seems to increase atrial fibrillation in some people. There aren't a ton of studies out there looking at randomizing patients to energy drinks. Anecdotally, we see it not infrequently, people drinking a lot of the energy drinks and showing up with atrial fibrillation as their cause. This is actually something fascinating. So we've had EKGs now for over 100 years. An EKG, 10 seconds, we see your heart rhythm, but we might miss it. So then we had 24-hour Holter monitors, then 30-day event recorders, and now we even have recording devices that we can inject under your skin that'll be there for 3 years to help catch any heart rhythm disorder if we need to follow it over a longer period of time. Those are the types of monitors your physician might prescribe or might recommend for you. On the other hand, there are now a number of ways a consumer can record their own EKG and their own EKG strips and find out if they have a heart rhythm abnormality. So you may have heard that the Apple Watch now can record your heart rhythm. There are a number of other devices out there that don't require the phone per se, but these are ways that you can capture it. What's really important is we can listen to a patient and it sounds like atrial fibrillation, but a lot of these can feel the same. So it is vital to catch this on some form of monitor, whether it's physician prescribed or doing it on your own online. I think it's really important to remember that people are people. Family practice, internal medicine docs are often very well versed in atrial fibrillation and can do a fantastic job. In general, however, there's been some studies showing that patients are going to be treated more appropriately if they see a cardiologist, and they'll be directed more quickly to the right treatments. As an electrophysiologist, I can tell you one of the most important things is time to diagnosis to treatment is going to really affect how well you do long term. So if you really are diagnosed with atrial fibrillation, I would really suggest seeing an electrophysiologist, a heart rhythm specialist, who can get you to that treatment quicker, even if it is a simple medication that doesn't need to go all the way through a procedure.